Welcome to Boosting Vaccine Confidence. We have some special guests with us today from the Washington Mystics. It's Natasha Cloud, the world champ from 2019, also second team all defensive team that season as well. And our partners at MedStar Health are joining us as well for this vital conversation. Ladies, thank you so much for your time today. And we're going to jump right into this. And I'm going to ask Tosh, how would you describe the current situation in Baltimore and DC areas when it comes to vaccine confidence among Black and Brown communities?
There's a lot of hesitancy, and that is a valid hesitancy with how Black and Brown people have been treated in the medical field. And so I understand it. There is no secret that Black and Brown communities were disproportionately affected by this virus. So that's why it's more important for us to get out here to make sure that we're in our communities voicing and supporting them getting vaccinated. So they find comfort in us knowing that we're getting it. It's really important for not only me, but for the Mystics organization as a whole.
And Dr. Ruiz, with that being said, what seems to be working in terms of that confidence of getting this vaccine? The hesitancy is real, but what is the message that you are utilizing to get that moving forward a little bit in terms of confidence with the vaccine?
Sure. I think as time has gone on, the confidence has increased in terms of seeing other people, especially leaders in the community, getting vaccinated and speaking out. I think that's really important. I also think that the conversation is personal. And so one of the things that I always try to do is try to understand where the hesitancy is, what is the question, what is stopping us, and what is driving us. And so I would say it's a little bit different for every person, but for the patients that I meet and the families that I counsel, I really try to understand what the questions are, what are the doubts, and try to address those, try to kind of empower people to make their choices. It is a personal choice, but empower people to take care of their health and to help their family stay healthy.
And Tosh, it's all been stated very well, especially over the last couple of months that the vaccine has been out there and available to our communities of Black and Brown people. But regarding the historical health inequities, the mistrust and the misinformation, how do you convince people that the government and the medical community have our best interest at heart and still kind of aren't seen as a priority when you're looking at the big picture of things? How does that change, and why is it so hard for equity to be achieved?
I mean, it is extremely hard for equity to be achieved across the board. We can talk about that all night long, about the systems of power that were set in place to see Black and Brown people kept out. But that's not what this is about. So for everyone in the Black and Brown community, everyone that it has to check off that other box, trust in us as athletes, trust in us that we have been, provided the opportunities and resources to sit down with some of the most renowned doctors in the entire world. And for me specifically, I've only met with Black women doctors for a purpose. How is this going to affect me? How is this going to affect my body long term? Will I be able to have children? All those questions I've gotten. So that is why it's so important for me to come out here to make sure people know that I'm being vaccinated and to find peace and calmness in me. Because there is a disconnect. There's a disconnect between administration. There's a disconnect between, us and trusting it with not being guinea pigs. So if I can be that beacon of trust, then that's what I want to be.
No doubt. And we're just going to end up here with Dr. Thomas. I know vaccines say what they're supposed to do, but some people may feel like they're the guinea pigs. They're the experimental people. And do I still need to wear a mask once I get vaccinated? I mean, it's not all free and easy once you get vaccine, correct?
That is correct. It is not all free and easy, but it's important for people to understand that specifically the COVID vaccine is designed for you to prevention of severe illness, hospitalizations, and death. You want that. Like, that's a good thing. And specifically, Pfizer and Moderna are 95 and 94% effective at getting COVID, but that means that it's still a chance that you can get COVID, which means there's a chance you can transmit it to someone. And if that someone also is not vaccinated, then they can get really sick from that potentially. And so we do still need to mask for those reasons of transmission. And we can be asymptomatic, meaning we don't know we have it yet, we're transmitting it. So it really is still important from a public health standpoint that we still do our due diligence with distancing and masking. To the point of, am I a guinea pig? There have been 100 million people, over 100 million people at this point who have received the vaccine. So while yes, it is new in the world of vaccines, you're not the first and you're not the guinea pig here. Are there things still to be learned? Will we need additional shots? Are there additional variants that we need to address and all of those things? Yes, but what we know now is that not having any protection by not having the vaccine is more dangerous and risky than having the vaccine.
I appreciate your insight today, ladies. Dr. Thomas, Dr. Ruiz, and world champion Natasha Cloud, we appreciate your time on this vitally important conversation and boosting the confidence about the COVID-19 vaccine. Thank you again for your time and your great insight.